Carpal tunnel syndrome is a very common problem that's faced by much of humanity. And we're in a world where we're often doing repetitive things with our hands, and it's a lifetime spent of doing repetitive functions with our hands that causes us to develop scarring in and around our wrist. In a simplistic form, our carpal tunnel is a space in our wrist that multiple tendons have to travel through, and a nerve called our median nerve. And we have a wonderful development of evolution in that we have very tiny, nimble fingers, and we can exert tremendous strength. But that only happens through the fact that many of those muscles are located in our lower portion of our forearm, and then they have to be complicatedly connected to our fingers through something called tendons. And those tendons are the primary thing traveling through the carpal tunnel with our median nerve. Eventually, over time and with many kinds of familiar things that we do during our life, we put a lot of stress on them, and then scarring develops, and eventually it becomes too tight on that nerve, the median nerve, and then that often is associated with numbness in our first 3 fingers or tingling, and eventually it starts to become a problem where we have pain on a regular basis, or we start to get weakness in our hand. The prognosis for treatment with carpal tunnel is excellent, and people have an outpatient procedure that lasts about 20 or 30 minutes. They go home the same day. They have stitches for about 2 weeks, and then they start physical therapy and find that they often have a very quick recovery.